I support capitalism. I think capitalism works. And unfortunately, I think some people have confused something. There's healthy capitalism, which is a small business owner who creates jobs, creates a service or a good people need. It's a farmer, it's a business that makes something, a manufacturer. That's all healthy capitalism. That actually works. But there's also what we call corrupted capitalism. And what that is the definition of greed. That is when you put your profits above the well-being and life of people. It's when we see an opioid manufacturer who writes in an email, let's make sure it's a higher dose so it's more addictive. Let's make sure our patients actually become addicted. That is the definition of greed, because they want to make a buck at all costs. I mean, even if you look at the Christian faith, it's the love of money that's at the root of all evil. It's not money, it's not capitalism, it's the love of it. It's the willingness to put money and that dollar above everyone. It's why the NRA is so corrupted. They put gun sales as their number one goal, not making sure that people who should have access to weapons can get them. We can absolutely support hunters' rights, but why would you want someone on the terror watch list to be able to buy a weapon? Why would you want someone who's gravely mentally ill with a violent background to be able to buy a weapon? Why would you want someone with a criminal conviction for a violent crime to get easy access to a weapon? Those are the only reasons they are against universal background checks. So we need universal background checks. We need to ban the bump stocks, the large magazines, and the assault rifles, and we need to have a federal anti-gun trafficking law. So that's it. That is the definition of greed. So I think for Democrats, we just have to be specific that we are for healthy capitalism. We want businesses to grow. We want jobs to be created. We want a strong and robust economy. And we're going to put things in place like investing in infrastructure, investing in job training, investing in better education for everyone so that we can grow the economy.
How can we sell Medicare for all as not socialists?
Yes, do you want to know how?
Yeah.
Got you. So I ran on this in 05. So I think if we start with the principle first, healthcare is a right and not a privilege. Because what we have right now, healthcare is a commodity. If you can't afford that drug price that the drug manufacturer is charging you, you don't get access to the medicine you need. If you can't afford the treatment you need, and your insurer won't pay for it, you don't get it. So it's a commodity. If you can afford it, you get it. If you can't, you don't. But we believe, I think, as a people in the Good Samaritan rule, that you should help anyone, no matter how sick they are. If they're on a street corner about to die, you pick them up and bring them to the hospital. We believe in that. So I think the quickest way to get to single payer and to healthcare as a right, not a privilege, is let people buy in. And so if you say anyone can buy into Medicare at 4% of their income, that's affordable. So let's say you make $100,000 a year. That's $4,000 for your health care. That is less expensive than you're likely paying today. If you are a low-wage worker and make $10,000 a year, you buy it at $400 a year. So that's how you do it. And you make it just like Social Security, where everyone buys in across their lifetime, whether working part-time or full-time, big company, small company. It's always there for you when you need it. And that's how you really, I think, create a much broader base to get everyone into preventive care. Second thing you need to do is you really got to take on the drug companies. When we passed Medicare Part D, drug companies made sure it was written into law that Medicare couldn't buy in bulk for the cheapest prices. Again, that's the corruption and greed that runs Washington. So you'd want to be able to get the lowest price for all drugs. And if some drug manufacturers continue to price gouge, I have a piece of legislation to pull back their profits. Because when you raise your rates 100% every year for the same drug, you're doing something wrong. That's not right. If you have a monopoly, we need to start enforcing antitrust laws on drug manufacturers. And last, if you're a manufacturer of a drug that's been around for a long time and there's still no generic because you keep manipulating your patents, I think we should think about whether we can ask the NIH to produce that drug, and I'll give you an example. Insulin. You know how many people need insulin today? Millions. And the person who invented insulin, who discovered it, he didn't even get a patent because he said, this drug is a lifesaver. I don't think I should make money off it, and I don't think anybody else should either. But the person who owns that patent right now, the company that does, they keep changing it little by little every year or two so they can keep that patent to be a new drug. Insulin's been around for a long time, and there's still no generic. It's not right. And so many people with diabetes, both type 1 and type 2, it's life or death. So I'm thinking if people won't make it easier to get a generic, we should ask the NIH to produce it. Create a little competition from the not-for-profit sector.